Good morning, I am Anslin, nursing tutor from Emmanuel Arasar College of Nursing. Now we are going to see about needle stick injury. The definition of needle stick injury is a needle stick injury is a percutaneous piercing wound typically set by a needle point but possibly by other sharp instruments or objects also. WHO reports on needle stick injuries are WHO reports in the World Health Report 2002 that of the 35 million healthcare workers, 2 million experience percutaneous exposure to infectious disease each year. It further notes that 37.6% of hepatitis B, 39% of hepatitis C, and 4.4% of HIV/AIDS in healthcare workers around the world are due to needle stick injuries. When it can happen? During blood collection, recapping, surgery, discarding, segregation of waste, mishandling of sharps. Who is at risk? Doctors, nursing staff, emergency care providers, labor and delivery room personnel, surgeons and operation theatre staff, lab technicians, dentists, housekeeping staff, mortuary staff. What can happen? Needle stick injury may lead to bloodborne diseases like HIV/AIDS, hepatitis B and hepatitis C. Our practices leading to needle stick injury are recapping needles, performing activities involving needles and sharps in a hurry, handling and passing needles or sharp after use, failing to dispose of used needles properly in puncture-resistant sharp containers at the correct time, poor healthcare waste management practices, ignoring universal work precautions. Post-exposure, don't panic, do not squeeze, wash with soap and water immediately, report it, consult doctor and inform infection control nurse, follow the post-exposure prophylaxis regime. Needle stick injury, exposure to blood and body fluid, management algorithm. Healthcare workers sustaining needle stick injury or splash. For needle stick injury, wash the area with soap and water. For splash, flush the mucous membrane with plenty of water and saline. Inform the infection control nurse or ward in charge or nursing superintendent as soon as possible. Healthcare worker initiates incident form. Case to be reviewed by CMO physician as per the guidelines of the treatment modality as soon as possible and maximum within 24 hours. Treatment to be provided as per the guidelines follows post-exposure prophylaxis. How to dispose sharps? Workers should place needles in wide-mouth puncture-proof containers. Locate disposal containers specifically where needles are used to make safe disposable possible without recapping. Replace the containers before they are completely filled. Make sure they are sealed, collected and disposed of in accordance with local regulations of biomedical waste. Take-home messages. Always follow right practices. Actively educate new personnel. Report needle stick injury immediately to ward in charge and infection control nurse. Remember, confidentiality is always maintained. Always follow up an injury. Try to minimize use of needles.